Hi everyone, my name is Cody Ames, and for my scientific episode, I'm going to discuss how the polio virus is being used to treat cancer. We already know that there are certain ways to treat cancer, such as radiation and specific surgeries, but using the polio virus is becoming a relevant topic in the scientific world. Looking at a study done at Duke University, researchers are beginning to engineer the polio virus for cancer treatment. Now, after nearly 20 years in development, they are in the first phase of testing on patients with glioblastoma at the forefront of their experiment. Now, I don't know if you guys know anything about glioblastoma, but it's a very aggressive and deadly type of brain cancer, and there are very promising results from these trials. The idea that certain viruses can be used to battle against cancer has been around for many years, but only recently has the technology caught up to the idea and being able to put it to use. Dr. Mattia Gromier discovered the way that poliovirus could be attached to a tumor and help combat it. Now, part of the poliovirus needs to be genetically engineered so that the actual effects of the disease would not take effect in the patients. Causing paralysis is a normal effect of polio, so in order to take that factor out, they had to cut a portion of its genetic code out and submit a small portion of a cold virus into the poliovirus to remove that factor. So when injecting it into the patients, they would not feel any normal effects of the poliovirus. The idea behind the poliovirus is that you directly submit it into the tumor. Surgically, you take a rod and you insert it right into the tumor. It infects a few of the cancer cells, and then the virus actually dies very quickly. But the reaction that it has in the patient's immune system is what makes a major difference. It drastically wakes up the immune system because the body recognizes the poliovirus and attacks it. Instead of actually attacking the poliovirus, though, it's attacking the infected cancer cells, which in turn, in theory, should kill the tumor. So the doctors initiated the surgery, inserted the rod, and then took a scan 3 to 6 months later to see if the tumor had decreased, increased, stayed the same, in order to see what the next status update was in the tumor. The doctors were concerned at first because after the initial scan, the tumor seemed to be enlarged, which was not expected. They at least expected the tumor to stay the same, but being enlarged was meaning that the poliovirus wasn't working. What they didn't know is that this enlargement was mistaken for inflammation. The tumor was actually inflamed because the immune system had woke up drastically and attacked it full force. So they did another scan later on, and the tumor actually did not grow at all, it stayed the same. And since glioblastoma grows very, very rapidly, staying the same means that it's working. So they kept this up, and after a period of time, they took more scans, the tumor decreased over time, each time it decreased, until the patients were actually either cured or lowered enough where they were in remission and could have surgery to remove the tumor. The polio treatment was working and was killing the tumor at a steady pace. Now, the trials did not go without their downfalls. They tried to use a higher dosage of the polio virus for certain patients who had very, very aggressive tumors and aggressive cancer. Some who were at their wits' end and had no other options, they had to use a higher dosage than what they thought. The higher dosage was actually a bad idea and had negative effects on the patients. Some even got that paralysis that the polio virus actually caused. So the doctors learned from their mistakes and lowered the dosage drastically in order to combat the negative effects. Now, Duke University team could be awarded a breakthrough grant within the next year if the results continue the way they hope they will. The doctors and scientists involved in this trial hope that the poliovirus can become a relevant weapon against cancer. Not only radiation with certain surgeries and medication, but this could be a formidable opponent against cancer and can be used widespread against more cancers than just this cancer, brain cancer, glioblastoma. They hope it can be used in lung cancer, liver cancer, breast cancer. It's something that is very exciting for these doctors who have spent years and years and years trying to find a way to cure cancer and have something that, resulted in some positive effects. Now, there was a 60 Minutes piece done on this very same topic, and it truly showed the life-changing effects that the poliovirus had for certain patients. There was a girl who had cancer, tumor, did the radiation, did all the normal treatment, seemed to be cured, and then it came rushing back quickly and grew larger and larger, and she was out of options. And they told her about the poliovirus treatment, and she took the risk and went with it. The thing happened, they had inflammation, they saw the scan, it looked bigger, but over time it decreased and decreased and decreased, and the poliovirus actually worked and killed the tumor, and she was cured. Now she is an advocate for the poliovirus treatment, and is a living example of how the positive effects can be when you actually use the poliovirus correctly. It's a very promising study that is getting more attention due to the increase in human trials, and its hope is to be a very helpful tool for curing cancer in the future. Hope you guys enjoyed the video, and thanks for watching.